It's not uncommon that I'll get asked questions about medication for OCD, but let me say first, I'm a clinical psychologist and not a psychiatrist, so I am not a prescriber. So I can go over a few things basically, but if you want really detailed information about medication and medication treatment for obsessive compulsive disorder, best to reach out to the person who can prescribe for you. Now, we know that the American Psychiatric Association says there are frontline treatments for OCD, and those are exposure and response prevention therapy or exposure and response prevention therapy plus medication. We don't suggest medication just by itself, right? Now, ERP does work on its own. Medication can definitely augment the experience for people, especially if people have tried ERP and they're maybe not getting the results that they would like to see out of it after a trial of it, which is usually about 10 to 12 sessions. Nothing wrong with that if you want to then talk to a prescriber about something along those lines. Why might someone consider medication as part of the treatment for their OCD? Well, maybe they have really intense symptoms, right? And ERP just feels a little bit too scary to do. Maybe there are some other co-occurring conditions that are going on, like depression or other anxiety issues. There's potential that just the way your brain functions or works, that maybe some additional support could be helpful. Or simply, some people just want to try it. And so that is a very legitimate reason for it. So let's talk a little bit about the three types of medication that are out there that people typically use for obsessive compulsive disorder. The first is what we call SSRIs, or serotonin selective reuptake inhibitors. And what these medications do is they decrease the uptake of serotonin from the synapses between the neurons after serotonin has been released. So let's just go before we even get any further, because that sounded really technical, right? If you've got a message coming down this neuron, it gets to the end. And our neurons are not actually connected to each other. There's tiny little spaces between called synapses. And so when that action potential, which is what we call that message, comes to the end of this neuron, instead of just it bending over and touching the next one, what it does is it releases chemicals. These are chemical messengers into the synapse. And if enough of those chemical messengers touch the next neuron, it creates another action potential, and boom, then it fires it down that one. And this occurs like lightning speed fast kinds of things. After that happens, where this neuron has released those chemicals, that serotonin is one of those chemicals, into the synapse, it has vacuums and it sucks it back up so that it can do it again. And so it's released, sucking back up, release, sucking back up. SSRIs shut off some of the vacuums, which means that more serotonin stays in the synapse, which means that it hits this next neuron more often, which means it creates more action potentials and can increase the activity over time in the brain. So that's just kind of an overview there. And by doing that, we have seen that it can have some positive impact potentially on anxiety and depression for people, and obsessive compulsive disorder as well. Now, these are typically prescribed for people who have OCD at a higher dosage than people who don't have OCD. So if your doctor or a prescriber is giving them to you and you think, wow, that's a really high dose, recognize that OCD usually requires higher level dosages. Then there's tricyclic antidepressants. Now, these are actually some of the best medications that are out there for OCD, but they have more side effects because they don't just work on serotonin. They work on things like norepinephrine, epinephrine, serotonin, various other brain chemicals or neurotransmitters that are going on. They work in a similar kind of function, but because it's hitting so many more chemicals, there's more potential for side effects. One of the big ones you hear from people is dry mouth. And one of the ones that can be more difficult and maybe even sometimes disappointing for people, there can be some sexual side effects for some of these medications. But luckily, there's other medications out there that can help counteract some of that. Finally, there's what we call atypical antipsychotics. Now, you may hear that word antipsychotic and think, wait a minute, I don't have a psychotic disorder. I don't have schizophrenia or something like that. At low doses, these atypical antipsychotics can help to maybe nudge the door open a little bit so that people can start to do the ERP work. When you hold on to a belief that a compulsion must be done to a near what we might even say delusional level, like you absolutely believe that is true, Most people with OCD will have good to fair insight. They'll recognize that, yes, logically, I know this doesn't make sense, but emotionally, I feel like I have to do it. But when those are kind of fused, where it's like, no, logically and emotionally, I have to do it, the atypicals can help to decrease some of that belief, the strength of that belief, so that people might be willing to try some exposure and response prevention therapy. So if you're thinking about adding medication to the work that you're doing, I would beg you to do a couple of things. Number one, make sure that you're working with somebody who really understands OCD. Number two, that knows what the dosage levels are for these medications. And number three, is going to be willing to work in conjunction with your ERP therapist. That will give you the best experience possible in your medication and therapeutic journey for the treatment of obsessive compulsive disorder. If you'd like to learn more about OCD and the treatment for OCD, well, please head on over to NOCD.com. That's NOCD.com. We have people waiting to speak to you. We look forward to hearing from you.